Hello, Dr. Lewis. We've been asked many questions, and this week is about autoimmune issues. So, because you did a podcast about autoimmune, could you tell the listeners a little bit about what to expect on the podcast and why they might be concerned with autoimmune issues?
I think the biggest thing you should be concerned about is getting too much information and not taking enough action, and I did address that on the podcast itself. What you need to do is find someone you trust and then let them guide you or coach you to a life with more energy, less stress, less anxiety, less depression. And autoimmune diseases are getting more and more rampant. I think it certainly seems that way in our office. So I think the best thing you can do is get well, not for yourself, but for your family. It means a lot to them.
That's good. And could you tell the people listening to this what some of the symptoms might be if it's a possible autoimmune issue?
You have to be careful with all these lists because you can get a list of symptoms for any particular disease, and it can be lethargy, fatigue, hair loss, can't sleep, can't wake up. It can be loss of sex drive. It can be allergies, sensitivities to foods, sensitivities to environmental toxins or what's coming through the air. There's such a long list. Yes, you need to be aware of these, but don't pigeonhole it down to one particular problem. The solution might be in many different areas.
And are you able to pinpoint those areas on lab work? I know you run low-cost lab work.
Right.
Are there certain markers on those labs that you're looking for that you'd be able to help someone understand if they had an autoimmune problem?
There's so many different ones. It's the ratio of different types of white blood cells. It's what your alkaline phosphatase is doing, your ALT, your AST, your globulin, da-da-da-da-da-da. It could go on and on. But yes, we can see patterns that's going on in your lab work from a functional nutritional aspect.
Oh, very good. Okay. So if you want to learn more about autoimmune issues and find out even more in-depth information, listen to your podcast this week on autoimmune.
Well, I might give you some more information, but I might make you laugh too. So you never know what's going to, come in through my head and what rabbit trail I might go down. You just can't tell.
Every day's a new adventure. Thank you for answering that for us, and we'll be here next time.